Hello again, everyone. I'm Scott Simon. Simon Says from Las Vegas, Nevada. And this episode is going to start a three-part series on 2019 Medicare tips, how you can get more out of your plan and save money. Now, when I'm not doing these podcasts, my daytime job is I am a Part D Medicare prescription drug plan individual advocate. I do it for UnitedHealthcare. And how I got to this point was this summer, I was recruited by a contractor to work as an agent. They said, we're going to put you through classes, and when you're done, you'll be able to advise members about their Part D prescription drug plan. Now, the coursework I took was 196 hours in the classroom and on the call center floor. Now, that equates into 16 semester hours in college. Students at a college get to do that in 16 weeks. I did 16 semester hours on Part D prescription drug plans in 7 weeks, in less than half the time. Yes, I crammed, and I learned a lot, and I continue to learn each and every day, because there's an awful lot to know about Part D prescription drug plans. That's what I handle. I don't handle Part A, B, or C, but I can talk about them because I did learn about them in my training. I'm going to give you the basics. I'm not going to make any recommendations regarding plans. I will give you tips that you should do for any plan that you take. I hope you enjoy this. Medicare enrollment is underway. It started on October 15th. It ends on December 7th. So you still have some time to shop around for a plan. And I'm going to complete this three-part series by the end of November so that you can make a choice. So let's get started with part one, the basics. When shopping for a plan, I want you to think of two things, because this is going to be really important for the rest of your life. One, Medicare is not private insurance. Medicare is government insurance that's administered by a private company. There's a big difference, and I'll explain why in this episode. Two, Medicare does not cover everything. I get lots of calls from people complaining why this drug isn't covered, and they say, I spend all this money, it should be covered. Well, I'm going to explain some things about Part D that a lot of people don't realize regarding prescription drug coverage. But this even holds true with Medicare Part A, Part B. There are some things Medicare Part A and Part B don't cover, and that's where a supplement plan comes in. I'll talk about that in these three parts. So let's get started with the basics. There are 4 parts to Medicare: Part A, Part B, Part C, Part D. And there is supplement, and there's something called Medicare Advantage. And now you're scratching your head going, wow, I've got a lot to learn. Okay, here we go. Part A. Original Medicare consists of Part A and Part B. Part A covers hospitalization. Part B covers trips to the doctors, but it does a little more than that. Again, Part A covers hospitalization. Part B covers going to the doctor. But there's more to Part B than that. Everyone gets Part A no matter what. You call Social Security when you turn 65 and say, I'm ready for Medicare. You're automatically enrolled in Part A, providing you've been paying Social Security benefits over the years. Part B covers this. Part B covers medically necessary services and supplies, including doctor's visits, preventative care, and durable medical equipment. Let's say you need a specialized bed. A specialized health bed would be covered under Part B. Now, where do you get Part A and Part B? You get it by calling Medicare Social Security. The number is 800-772-1213. Everyone gets Part A free of charge if they've been paying Social Security benefits. Part B has a premium. The 2019 premium for Part B, if you make between $0 in a year to $85,000, the monthly premium is $135.50. It goes up a little bit if you make more than $85,000 a year. Let's say you make between $85,000 and $107,000 this year. Well, your Part B premium in 2019, the monthly premium will be $189.50. Again, if you make more than $85,000 but less than $108,000 next year, you'll pay $189.50 per month. But most Americans make less than $85,000 a year, and the premium next year is $135.50, and that's $1.50 a month more than it is this year. Now that we've covered Part A and Part B, let's go to Part C. What is Part C? Part C is a combination of Part A and B. And this is administered by private insurance companies like UnitedHealthcare, Aetna, Humana. There are many others. It's administered under a plan that's called Medicare Advantage. Medicare Advantage combines Part A, Part B, and it includes prescription drugs. And I'm going to talk about prescription drugs in just a moment. So this is a part that you'll want to consider if you want that blanket coverage, A, B, and prescription drugs, which is Part D. And I'm going to talk about that separately because there's a reason why. You call an insurance company to find out what the premiums are for Medicare Advantage. Again, that will cover hospitalization, medical, and prescription drugs. Part D is separate. It's prescription drugs for individuals. Now, this is for people who want to have separate plans. They want a separate A and B plan from Medicare. They don't want Medicare Advantage, but you must have prescription drug coverage. Listen again. You must have some type of prescription drug coverage if you are in the Medicare program. You can do that by getting it covered under a Medicare Advantage plan, which is Part C, or you can take A and B from Medicare and then add a Part D prescription drug plan from a private company, like the ones I mentioned. You must have prescription drug coverage. And you must do it from day one when you sign up for Medicare. If you do not, and down the road, in a year, 5 years, 10 years, you say, oh, you know what? I want prescription drug coverage now. I didn't have it before. You're going to pay what's called a late enrollment penalty. Or short, we call it LEP, late enrollment penalty. What this is, you are going to be assessed a monthly fee based on a percentage from a fixed dollar amount each year. The dollar amount in 2018 that Medicare calculates for late enrollment penalty is about $35. You will pay a penalty of 1% a month. So if you only had a few months where you didn't have prescription drug coverage, your LEP is going to be kind of low. But I have had members who went 5, 6, 7 years without a prescription drug plan, whether it was Medicare Advantage or Part D, and their monthly late enrollment penalty was $15 to $20. That's on top of your premium. And here's why you need prescription drug coverage from day one. Late enrollment penalty is for the rest of your life, and there's no way you can get off it. The only way you can get off it is if you can prove that Medicare and private companies calculated an error where you did have prescription drug coverage. But if it's found you did not, and you get prescription drug coverage down the road, you'll be charged a late enrollment penalty. Again, I had a woman a couple of weeks ago. She was in her 90s. For many years, she did not have prescription drug coverage. Her monthly late enrollment penalty was $16 a month. Multiply that by 12. And you can see that she's paying almost $200 more a year for her prescription drug plan that she didn't have to. And now there's a reason why there's a late enrollment penalty. And it gets back to what I said earlier. Medicare insurance is not private insurance. I like to call it a national group plan mandated by the government and administered by private companies. And because of that, I want you to listen very carefully to this. This is the enrollment period, October 15th through December 7th. It's this date period every year, without fail. You enroll for the following year, and your plan begins on January 1st and it ends on December 31st. When you contract for any Medicare insurance plan, whether it's Medicare Advantage, Part D individual prescription drugs, or supplement, sometimes called Medigap, you're required to have that plan for the entire year. It's not private insurance. You just can't cancel whenever you want just because of something you don't like. I've had people call up and say, I'm going to stop paying. I ask them the reason. They say they didn't like the plan. They're going to shop around. Guess what? You can't. I'll explain disenrollment here in a future episode, but not this one. Just put in your mind right now that when you get a Medicare insurance plan, it's for a year, January 1st to December 31st, and Medicare Social Security expects you to pay that plan every month. Now, let's say something happens in your life where you can't afford it. Just call your plan and say, I can't afford it. They will put you on a repayment plan. You'll pay a little bit each month to repay while you continue paying forward in your plan. Companies are very willing to do that. We don't want to lose you as customers or members. We want you to have the Medicare services you so richly deserve. But your obligation is that you're going to be paying on that plan each and every month for a year. And if you don't, you will be disenrolled. If you stop paying on a plan and you're more than 63 days past due, you will be disenrolled. And if you think the due balance that you owe goes away, it doesn't. Companies can send it to collections, and that record of what you owe is known by Medicare, and it can prevent you from getting future Medicare plans. So it's not like bankruptcy where you can wipe the debt out. It stays on your record. Just last night, before I recorded this episode, my last call on Wednesday, October 17th, was from a woman who's calling to find out why her bill for a disenrolled plan was $1,600 and why she couldn't get insurance for next year. I won't get into the details on this episode, but I will in either episode 2 or 3. This member had low income subsidy from Social Security to help her pay her premium. That is available. If you find that the premium's too high because your income's too low, Social Security has low income subsidy. The low income subsidy can cover the full amount of the premium, but oftentimes it doesn't, at which time there's a difference. I'll give you the example. The woman had a premium of $50. Her low-income subsidy was $28. She was required to pay $23 out of her pocket each month to maintain this plan. She didn't do it. She just assumed low-income subsidy paid for everything, and it did not. 23 times 48, and now you know how we got up to such a high amount of $1,671, which she owes. She's in a bit of shock. But get this. Her failure to pay wasn't the reason why she was disenrolled. If you're on low-income subsidy and you're in Medicare, you cannot be disenrolled if you cannot pay your bill. That's right. If you're on low-income subsidy for your Medicare plan and you don't make up that difference and it accrues a balance, Social Security can't disenroll you. That's the law. Here's why she was disenrolled. She enrolled in a second plan. And the Medicare rules say that if you enroll in another plan of equal or greater value than the prescription drug coverage that you currently have, you will be disenrolled. She didn't realize she enrolled in another plan. And I couldn't figure out because I couldn't research it because she didn't even have her Medicare claim ID card. That's the red, white, and blue card. I'm going to talk about that in a second. I could have looked up the plan she enrolled in. This woman was completely unprepared and didn't do her homework, and now she's going to pay for it. So just listen very carefully again. When you enroll in a Medicare plan, you don't get to cancel. You get to change plans between October 15th and December 7th, but you don't get to cancel. You disenroll from one plan and you enroll in another. So this woman has some problems. I told her, I said I felt sorry for her. She needed to call Social Security, get some tips on what she could do so she could enroll in a plan next year, and what she could do to repay her balance. She's got a big mess. She's got to take care of that before she even considers what plan she wants for 2019, if she can get one. So don't mess around thinking that Medicare insurance is the same as private insurance. It's not. You contract it, it's for a year, and it's durable. In episodes 2 and 3, I'll talk about how you can disenroll from a plan and the time period of when you can. The last coverage I'm going to talk about is called supplement. And you see the commercials on television, hear them on the radio, and see them in the newspaper. Supplement is a separate plan that covers things Medicare doesn't cover. I'll give you an example. Hearing aids. Hearing aids isn't covered by Part B. However, supplement plan will cover that. Many other things are not covered in Medicare that a supplement plan will. As you get older and you need more medical assistance and services, it's excellent for you to look into such a plan. If you have disabilities, it's something that you should look into. But the basics of Medicare are Parts A, B, C, and D. A and B are original Medicare. A covers hospitalization. B covers medical services. It even includes covering an ambulance trip. You pay a premium for that. If you make up to $85,000 a year in 2019, your premium will be $135.50 a month. Part C is called Medicare Advantage. That covers A and B and also provides prescription drug coverage, which is required. But if you don't want to combine A, B, and D into Part C, you can have a separate A and B and separate D plan. Part D is also called Individual Prescription Drug Plan. You'll hear that sometimes. Now, with that, I'm going to conclude with this nugget that I think people will find interesting. So here goes. Cialis. Most of you know Cialis is a erectile dysfunction drug. Medicare Part D does not cover erectile dysfunction drugs. Cialis, Viagra, and the others. Not covered. I'm going to give you the exclusions for Part D in a second. Because, like I said, Medicare doesn't cover everything. Remember that. Number 2, Medicare does not cover everything. But Cialis can be covered in your Part D or Medicare Advantage plan. How? Cialis actually works for people with heart conditions or prostate problems. It's been proven medically that it can help those who have heart conditions, and it's been known to help people who have prostate problems. There are some drugs that are not covered, called a non-formulary, which eventually can be covered in your plan. It's called coverage determination. And it's a process where your doctor files paperwork about your medical condition with a board of review saying, my patient has a severe heart condition and Cialis actually regulates his blood pressure enough to where it actually helps his blood flow. And Cialis has been covered in a Part D prescription drug plan. But it had to be done through coverage determination. I'll talk about that in upcoming episodes. So I always thought that was kind of funny. People thought, oh, wow, and a male erectile dysfunction drug not covered by Part D, and everybody gets a chuckle. But Cialis actually does have a medical benefit other than erectile dysfunction. Now, let's talk about just a little bit what Part D prescription drug plans don't cover. They won't cover weight loss or weight gain drugs. Part D won't cover cosmetic purposes or hair growth. Part D won't cover fertility, which you think's kind of funny for somebody over the age of 65 and a female, but people under the age of 65 can qualify for Medicare if they have a qualifying disability. We've already talked that sexual or erectile dysfunction drugs aren't covered under Part D. Over-the-counter drugs are not covered in Part D. So I think I'm going to end episode 1 right here. You can go online to medicare.gov, and it's a wonderful website that explains everything you need to know. If you have any questions, call Medicare, 800-772-1213. In episodes 2 and 3, I'll get more into the things that you can do with your plan to get more out of it. I briefly talked about it just a few minutes ago. Coverage determination. Some drugs aren't covered in a prescription drug plan, whether it be Part D or Medicare Advantage. However, they can be covered through the coverage determination process. I'll give you an example of another reason why coverage determination gets drugs included in a plan. There are some people that cannot swallow tablets or capsules, and they need to take a drug in a different way other than orally. And there are medications that are provided that don't have a tablet or capsule form. That's where the coverage determination comes in. There are some drugs that patients are allergic to, and it's a brand name drug, and the generic is not covered, or vice versa. Coverage determination can be used there to get something covered in a plan. it's best you educate yourself on everything in advance, because there are a lot of parts to Medicare that you need to know, that you need to take control of. Don't just automatically think that your insurance plan will take care of everything for you and pay for everything. I'll sign off with this. Start looking online what the coverage gap donut hole is. I'm not going to talk about it here, but it's the number one complaint we get at our call center when somebody goes in and says, how come my copay tripled on this drug that I was normally paying so much less for? The reason, they reached the coverage gap donut hole phase of their plan. Most plans have 4 phases. I'll explain those in episodes 2 and 3. But for episode 1, I hope you learned some of the basics. 1, Medicare is not private insurance. Medicare doesn't cover everything. There are 4 parts to it. You must have prescription drug coverage. You can get that in a separate Part D or Part C with a Medicare Advantage plan. I'm Scott Simon, Simon Says. Yes, I podcast, but my daytime job is I'm a Part D individual prescription drug plan advocate for UnitedHealthcare. I hope I help you with tips to choose a plan between now and December 7th. So until then, I'm Scott Simon, Simon Says, saying so long from the greatest city in the world, Las Vegas, Nevada.